ECMO is basically a portable form of the heart-lung machine. It's a limited resource that requires the expertise of a number of individuals. And unfortunately, it's something that when you need it now.
The Patient Logistics Center has a direct line with the transfer center. The call comes in, and once we get that call, we go into action. You stop, and you move, and you go, and it happens.
It's very fluid. That's where the team approach comes in there. It's everybody comes together and says, how are we going to pull this off?
We got everything here we need.
Yeah, perfect. Paul's bringing Dr. Minetta over and we'll meet us in the ambulance bay.
Bag checkout looks pretty good.
Yep.
All right, let's roll.
I guess if you were to ask anyone if you could define team, you would probably hear a group of individuals all working together to achieve one common goal. For the ECMO-TO-GO team, that common goal is to save a life.
All the tools, instruments, materials that we would need, we've thought about and we have it in our to-go bag. You know, time is of the essence because that patient's hanging by a thread.
Oh yeah, we're on 2 minutes.
One of the first stories that I recur for saving the patient in ECMO, he was a young gentleman, probably in his 50s, a very, active community member, and he came in with an acute pulmonary embolism. And he was basically undergoing CPR at the time. We placed ECMO in the ICU. And, about 5 days later, he walked out of the hospital. And he was basically dead up until that point in time. If that didn't happen, he wouldn't be around.
You take the desperately ill patients that otherwise would probably die right there. And it provides, hopefully, the next step for a life-saving measure.
CTSU, this is Michael speaking. Coming from Jamaica Hospital.
It's really difficult to put into words how incredible it feels to walk into the waiting room after a big surgery and meet the anxious family members, greet them with a smile and say that everything went okay, and just watch all this attention leave the room, and it's just really an indescribable, amazing feeling.
The payoff is someone who would die is going to have a chance to live. That's at the end of the day. These are people who are mothers, fathers, children, husbands and wives, and they're going to die. So this is a chance for them to resume their lives.
So guys, we have a 47-year-old patient coming from Jamaica Hospital. ECMO-TO-GO was recently called. They should be here within the hour upon cannulation.
Northwell is, we have a lot of innovation, and we have developed teams to continue to strive for saving patients' lives. So it was just the next phase of our growth and development as far as cardiac and pulmonary goes, and to save lives, for our community.
I'm most proud that the team works together, that we're able to pull everybody together to make this happen. It's not about the surgeon putting in the cannulas, it's not about the doctor there, it's about everybody else, the nurses, the perfusionists, the ancillary staff, everybody pulls together to make this work.
Everyone that's around this program has been touched in so many different ways. Words can't put it into.
Yeah, I think at the end of the day, you just realize when everybody comes together, what you can create and what you can do. And I'm truly humbled by that.